Physicians, what's the worst injury you've seen on a routine checkup? My brother once jumped on the front of my white car, grabbing the front pillars with his hands. I closed the door and caught his finger, which he pulled out quickly, as you do, but there was a tiny chip of paint that had come off the car and got lodged under the skin somehow. He must have spent a week or so chewing on it to try to get the paint out, but it just wasn't working, so he went to the doctor to see if he could help. After checking it out, the doctor tells him, the reason you can't get that out is because it's your bone. Apparently when I shut the door on his finger, I'd broken the tip of his pinky enough so he could see the bone through the skin, and he'd spent the next few days trying to pull his own finger bone out with his teeth.
It's pretty crazy how things turn out. Not really the kind of DIY fix you want. Sounds like a lesson learned about doors and fingers. Sometimes it's just better to let professionals handle it.
Not a routine checkup. A woman 36 weeks pregnant comes into the doc in the box complaining of nausea, vomiting and pain between her shoulders. We ultrasound her abdomen, everything was fine with the kid. Somebody had the bright idea, as long as the ultrasound was out, to ultrasound between her shoulders. To our astonishment, she had a huge dissecting aortic aneurysm. She had to be survival flighted to a level 3rd place and have a crash C-section and her aneurysm fixed. The aneurysm was at least 5 centimeters across. She and the baby both made it.
It's wild how they found the aneurysm when checking her abdomen. The timing was crucial, and it sounds like they acted fast. Good to hear both mom and baby are okay after all that. Definitely not something you expect during a routine ultrasound.
Not a physician but a clueless patient. Went to go see my doctor for a checkup, had chest pains waking up that morning, started to feel like someone is sitting on my chest, walked 15 minutes to the physician's place, and apparently after he checked my breathing he told me I had to go to the ER to get my lungs x-rayed. Spent a week in the hospital for having a 40% collapsed lung. Doctors called it a spontaneous lung collapse. Really not the kind of spontaneity I'm looking for in my life. Edit, a lot of people are asking if I'm tall and skinny. I was pretty fit at the time, was running half marathons, and I would say average height, 5 feet 11 inches. Also, never smoked anything ever.
That sounds pretty rough to deal with. A spontaneous lung collapse is no joke. It's good you got it checked out though. Walking to the doctor while in pain shows some determination. Interesting how your fitness level didn't prevent it. It's a reminder that health can be unpredictable. Glad to hear you're okay after the hospital stay.
Not a physician, but I was doing medical service in Guatemala and we had an older gentleman come into our clinic to have a checkup, and the entire time he sat there with us, he was resting his arm on what we thought was a bag or purse on top of his leg. At one point he goes to move, and we see a huge lump underneath his poncho, what we thought was his bag, and ask him about it. Turns out it was a tumor that had been growing for around 10 years on his leg, and he wasn't even going to tell us about it.
That's pretty wild. It's surprising how some people choose not to address things like that. A tumor for a decade, and he just kept it hidden under his poncho. Makes you think about what others might be dealing with that we can't see. Glad he showed up for the checkup though. Health issues are tricky.
Mine's nothing on the few things that are here, but I can share something I found myself. I'm an ophthalmic technician. Basically my job is to do the diagnostic scans and workups on patients before the eye surgeon sees them for routine consultations. One lady came in, referred from her optometrist for cataract surgery. The optometrist did note she had slightly higher than normal pressure in one eye at 23, normal ranging typically between 10 and 20. When I checked her pressure it had risen to 35. Normally straight after this I would dilate her eyes so the doctor can see inside, but I told the lady that based on a hunch I wanted to do a scan of the angles between her iris and cornea before doing that. I found that these angles had closed. Basically, due to her growing cataract, her iris had pushed out, blocking the gap at the outer edge of her iris where the fluid in the eye generally flows. Because of this, the fluid in her eye was very quickly rising. Acute angle closure glaucoma isn't rare, but if you dilate someone's eye who has it, you close those angles even more and eye pressure continues to rise rapidly, causing death of nerves in the eye. I'm just the tech, but thanks to my hunch and scanning first, I could have saved her sight. The doctor performed laser treatment that day to hold those angles open until her cataracts can be removed.
That's interesting. Sounds like you played a key role in a critical situation. Catching that condition before dilation was important. It's good to see how your intuition guided you. The pressure readings were definitely a red flag. Overall, it's a strong reminder of how crucial your work is in preventing serious complications in eye care. Glad everything turned out okay for that patient.
Nurse, but some guy came in with Lefort 2 and 3 fractures. Said he fell and hit his head on a tractor step about a week ago. Was just coming for medication refills when we asked about the mild facial trauma, tiny laceration, unremarkable bruising. Denied all pain medication, and very minimally accepted it after surgery only because we practically talked him into it. Maxillofacial surgeon was excited about it, she came down personally to get him and take him up to surgery. Edit, TL, his face was floating and not attached to the rest of his skull.
Sounds like a pretty rough situation for that guy. Lefort 2 and 3 fractures can be serious. It's interesting how he downplayed the pain and was hesitant about medication. The surgeon must have been eager to get to work on something like that. Floating facial bones aren't something you see every day. Hopefully, he's on the mend now.
Another, not a doctor but. I arrested a guy after a brief foot pursuit for attempted burglary and several other nuisance charges. He was covered in blood from multiple small scratches when I first found him and had a decent-sized gash above his eye that looked like it just needed a couple stitches. Took him to the ER. To get stitched up and they did a CT scan. Doctor is stitching the guy up and about to release him when the CT comes back. Fractured orbital resulting in an air pocket forming in the guy's brain cavity. Turns out the guy dove head first off a rooftop earlier in the night and hit a fence on his way down. Meth makes things exciting.
You think you're just taking someone for stitches, and it turns into a whole different story. The guy really made some bad choices, diving off a roof like that. Meth definitely adds a layer of chaos to everything. Glad you handled it, but I bet it was a bit of a surprise seeing that CT result.
I'm the moron patient. I had fallen through a ceiling 3 years prior, and had just worn a knee brace. My employer required me to go to the company doc for a yearly physical. I'm not a doc, so I can't gauge, but here's the list that came out of that visit: torn meniscus, ACL, rheumatoid arthritis, Hashimoto's disease. And the place I went had in-house genetic testing and the doc suggested that I should get tested, since I had Hashimoto's and rheumatoid, to help determine what else I had. It was out of pocket, but I thought, why not? I'm sure it was one of those upsell sort of deals, but it really paid off in my case. Test found all kinds of crazy shit that I carried but don't have as of now, most of it autoimmune related, but found Thompson's disease, which is what those fainting goats have that cause them to faint. In reality, my understanding is that they don't faint, their muscles involuntarily lock up, and they just physically can't get up. I have a mild case of it that only affects my arms, but it's estimated that like 1 in a million have the mutation. I have to wear a brace on my arms from time to time if I have to make a very quick movement. I'd had a lot of unexplained muscle soreness that suddenly made sense. Another weird side effect I have is that I have trouble swallowing food from time to time, and if I go all day without eating, it's almost impossible to hold my eyes open by the evening, and it has nothing to do whether I'm sleepy or not. He is my primary care now. Amazingly thorough. Edit, I'm passing out. Catch you guys later. Cheers.
That's quite the list of health problems you got there. It's interesting that the genetic testing found something like Thompson's disease. Involuntary muscle locking sounds pretty annoying, especially if it's in the arms. The swallowing issue also sounds problematic. Hope things get better for you.
This was not a routine medical exam, but I was a triage nurse in the ER when a patient calmly walked up and reported a complaint of pain in my side. He failed to mention the blood and the handle of the butcher knife sticking out of the left lower quadrant of his abdomen. He was a homeless schizophrenic who had been stabbed and had calmly walked into the ER and waited his turn to be seen. I am just glad he came in at all. We also get a lot of people who come in for other things, a sore throat or a cough, and when doing a skin assessing we find huge pressure ulcers or gangrenous feet. I have twice had a patient's toe come off when I removed their sock. Neither time had they come to the ER for that issue.
It highlights how unpredictable the ER can be. People often come in for minor stuff, but you never really know what's going on under the surface. It's a tough job dealing with that kind of unpredictability, but it's good he came in when he did. It must be hard to see such serious health issues in people who might not even realize it themselves.
Not a physician, but my doctor might qualify. Got a fever for a few days, had no other symptoms. I know that a fever without other symptoms can be really bad, so I go to the doctor. He says it's probably the flu and sends me home. Fever gets a little worse. I call him and tell him it's up to 102, and he tells me to go to the hospital. I get there, they give me drugs to reduce the fever, and do some blood work while keeping me in quarantine. Got my own room, which is nice, because they didn't know what I had. Blood work comes back, and I'm septic. They said that it came from too much oral bacteria getting into my bloodstream, and that they usually see it with druggies that lick their arm before sticking a needle in, thinking somehow that it's sanitary. I traced it back to a mechanical toothbrush I got and how it made my gums bleed like crazy when I first started using it. So, yeah, go easy on your teeth if you have sensitive gums. The bacteria in your own mouth can kill you if they bleed too much.
Sepsis is no joke. It's a reminder to take care of your health, even with everyday things. Sensitivity can be more significant than it seems. Hope you're recovering now. Keeping an eye on dental health is important.
Guy shows up for a discharge physical, Marine. Noticed what looked like cellulitis on his leg. Turns out it was a brown recluse bite that he ignored. Had a fist-sized hole of dead tissue in his leg. We treated it with maggots for a few days. It healed over with a very nasty dent/scar. Edit, yes, maggots are still a thing. We import them from Mexico. We dump them straight into the wound and put a clear cover over it, so we can see them. We check a few times a day to make sure there aren't too many dead ones in the wound. They will eat only the dead tissue, and yes, the patient can feel them squirm. We also use leeches. They are good for the anticoagulant effect for things like finger reattachments. They keep the blood flowing and keep swelling down so the blood vessels can reattach and heal. We use cats in nursing homes to keep the residents in better spirits. Even the worst Alzheimer's patient seems to respond to cats. We also use electric eels to help keep babies awake so they, okay, that's not true, but it is funny.
It's wild how these old school methods are still in play. Using cats in nursing homes feels like a smart move for the residents. The electric eel joke definitely lightens the mood though.
This is probably going to be buried, but oh well. It was a nurse back in South Africa who made the discovery. When I was 6 or 7, I started feeling very ill. You know, fever, nausea, the standard symptoms of everything. Went to my family GP, saw me, and didn't even do a physical examination. Declared that I just had a particularly bad case of the flu. Fast forward to 2 days later, I wake up in my bed laying on my back, screaming for my mom, and in fear, because I can't fucking move. Total limb paralysis. Mom, being the good parent she is, made the call to take me to the ER. She mentions that our GP said it was the flu, and it might have been a bad symptom. Nurse, bless this woman, does a physical, finds a tick tucked under my armpit. Turns out I had tick paralysis, and it was pretty far advanced. According to the attending, via my mom, if it had been a day, or even 5 hours, considering what sort of mood she's in when she tells the story, later, I'd be dead because it would have shut down my respiratory system. Not as insane as some of them here, read the ones about nut sacks being torn open, gangrene, et al., but goddamn. I'm thankful for nurses even to this day. Edit, I wasn't a nurse, just for clarification. My typing style is just horrible. Also, Jesus. My highest rated comment so far is about me nearly dying. Cool.
That's a pretty intense story. It's wild how a simple case can turn into something so serious. It's good that your mom got you to the ER in time. Nurses often catch what others miss, so it makes sense you'd feel grateful. It's crazy how these experiences shape our views on healthcare. Hope you're good now, though. Sounds like it was a close call.
Not me and not a routine checkup, but my uncle is a severe hypochondriac, and it almost always leads to complete hilarity. This is my favorite story of his nonsense. He, along with my aunt and cousins, had a big family trip planned about 5 years ago. Don't remember where to, but far enough that they had plane tickets booked. Fast forward to the day before the trip, my uncle says he can't go. He says he's been seeing this weird object in the corner of his right eye for a couple days, especially any time he turned his head to the right. Naturally, to him, that means he's dying, and he doesn't want to die on their trip and make his family deal with flying his body back home to bury him. So, the entire family ends up staying home and canceling their vacation plans. My uncle goes to the doctor 2 days later, convinced he was days away from death. He tells the doctor about this weird object he keeps seeing out of the corner of his eye, but can never really focus on. Doctor initially thinks it might be an eye issue. Uncle is convinced it's a fast-spreading terminal brain tumor that is, somehow, foretelling his imminent death. Doctor takes a closer look, only to find that the object my uncle kept seeing in the corner of his eye is nothing more than an enormous gray ear hair coming out of his right ear, literally, like a 6-ear hair, that often happened to find its way into his line of sight, most specifically when he would turn his head to the right. TLDR, my uncle thought an abnormally long ear hair was a sure sign of his imminent death.
That's pretty classic. Your uncle really went all in on that. It's wild how our minds can jump to such extreme conclusions over tiny things. At least the doctor had a straightforward fix. I guess a good pluck took care of the problem.
I was working at Target, lived half a mile away, so I walked to work. It totally sucked, but I was out of shape and have cold-induced asthma, so I ignored it. At this time I was picking up shifts left and right, so sometimes I was closing the coffee shop, sometimes coming in at 4 a.m. to unload the truck. I was basically a zombie from what I assume was lack of sleep. This goes on for a couple months, until I had my annual physical. I was joking with my doctor that I was super exhausted from work, and I must be getting out of shape because that half-mile walk to work really sucks. Turns out I had severe pneumonia. One lung was totally full of liquid and the other had some liquid too. The doctor couldn't believe I was still up and about, let alone walking to work and whatnot.
That sounds rough. Working all those shifts and dealing with pneumonia is tough. It's surprising that you were able to keep going like that.
As a radiologist, we see things that have been swallowed by kids all the time. I've seen a fish hook, marbles, open padlock, 5 cm steel nail, batteries of all shapes and sizes, open safety pin, and countless coins, to list a few. So long as they get past the stomach, they usually pass through pretty well, except the fish hook. But the ones which have caused the most damage are buckyball-style magnets, which can attract to each other through the bowel wall, causing perforation and leakage, or button batteries, which rapidly discharge and burn through tissues. There have been deaths from these seemingly harmless little things.
The list is long and kind of surprising. Some items seem harmless but can cause serious damage. The magnets and button batteries sound particularly dangerous. It's good that most stuff passes through without issue, but those exceptions are really concerning.
My grandmother. She's allergic to the spice and peppers. So she goes to a church event and eats something that has capsaicin in it without knowing. Almost instantly her face swells. She just chills like that for a whole day before my mom finds out and tells her to go for a checkup. We just expected them to give her a really strong antihistamine and we go about our way. No. She had to be rushed to the hospital because all of her insides were swelling and her organs were getting close to failing. She had one completely collapsed lung, and a partially collapsed lung, which was causing more issues because there wasn't enough oxygen in her blood. It was wild. But she's still here.
It sounds like a pretty serious situation. Good thing she ended up getting the help she needed. That must have been intense for your family, but it's a relief to hear she pulled through. Just goes to show how things can change in an instant with allergies.